Welcome to our Anesthesia and Critical Care Medicine video series. Today we're going to talk about shoulder surgery and what might go wrong with these cases. So many of us, when they have shoulder cases, they like to do interscrene block pre-op for surgical purposes or post-op for pain control. But interscrene block, actually, it has a very close relation to other nerve structures and other major vessels. And sometimes you go into trouble with this block. So some of these problems are critical and some are just side effects. So today we're going to talk about these problems and how to prevent them. We're going to start with the critical problems. First of all, when you're doing this block and your patients start to have seizures, immediately you have to think that you got the vertebral artery and you aim posteriorly while you are injecting. So the way to prevent this, never aim posteriorly and do a lot of frequent aspiration before you inject. Second, if you are doing this block and your patient turned apneic and they have not breathing, not responsive, this is a problem happens when you having total spinal secondary to intraneural injection. So the way to prevent this, never inject under high pressure. Because if you are injecting at higher pressure, this means that you are intraneural. Or if you are using nerve stimulator, and if you're still getting response less than 0.2, this means that you are intraneural. If you have high pressure or motor stimulation at less than 0.2, you have to step away and not to inject under these situations. Definitely pneumothorax. If you are aiming deep toward the lung, definitely you will get the lung and you will have pneumothorax. And this is definitely can be prevented by not aiming very deep. You will get the response in 2 or 3 centimeters, and always try to use the ultrasound and not to aim toward the lungs. These are the critical ones. What about the other problems that may happen during the interscrene block? Some of these are really common, and these need to be addressed with the patient during the consent, and the patient need to be reassured if they happen after the interscrene block. So some patients, they got dyspneic, they got some mild saturation after interscreen block, and this happens secondary to the phrenic nerve palsy. And as the literature says, it happens almost in all patients. Phrenic nerve palsy, it happens like almost 90 to 95% of patients got interscreen block. Some patients may get hoarseness of voice, and this happens secondary to the recurrent laryngeal nerve paralysis. So if the patient in the PACU has some change of voice tone or has some change in voice, just remember to reassure the patient that this may happen due to interscreen block. And finally, the patient, if he has like some eye symptoms, like his eyes, his eyelid has like some ptosis, he has constricted pupil, some red eye, just remember also that it happens during interscreen block in the same side of the block. This topic came from the famous website, the Nizura, and from the book Anesthesia Unplugged, page 270 and 271. Thank you for listening, and please don't forget to subscribe to our channel. Thank you so much.